Committee. We are going to hear the following bills in the following order. House Bill 279, House Bill 213, House Bill, I'm sorry, House Bill 279, House Bill 181, House Bill 410, and House Bill 417. Okay? And we still have a few members who are still trying to get here, but we're going to proceed in any case. All right, so Lindsay, could you tell us about House Bill 279?
This is a departmental bill from DPSCS, which establishes a policy for the administration of psychotropic medication to an incarcerated individual in a licensed mental health infirmary within a state correctional facility who refuses the medication. The policy parallels current law provisions governing the administration of psychiatric medication in state mental health facilities. The bill specifies when psychotropic medication may be administered, provides for the composition, procedures, and responsibilities of a medication review committee that determines whether to administer psychotropic medication on a non-emergency basis, outlines the rights of an incarcerated individual in relation to committee meetings and decisions, including a right to an administrative hearing and an appeal, and requires a treating practitioner when administration of psychotropic medication is ordered to document the benefits and side effects of the medication on a specified interval. There were two amendments offered in committee testimony offered on this bill. The first from DPSCS would provide the right to legal counsel should the incarcerated individual request a hearing with the Office of Administrative Hearings. And then you also received testimony from the Schizophrenia and Psychosis Action Alliance that requested amendments to assure that the lay advisor on the committee has appropriate knowledge and qualifications, assure that the facility staffing and medical oversight are appropriate to ensure safety, assure that the medication review committee receives information from the family, outpatient providers, and others to enable safe and efficacious decisions.
All right, thank you. So I'm just be very clear this is obviously an important bill, and we heard good testimony on both sides. What I would like is to have the department, whoever's speaking for DPSCS, speak to just very quickly the amendments and what your position is about the amendments and if there are any other changes. And then I'm going to ask someone to speak I guess for the Office of the Public Defender about the amendments and other concerns. And then, frankly, I think we are going to have a plan for this, particularly if there continues to be, a lot of difference of opinion about this bill. So, DPSCS, who's speaking for you all today?
Hi, Delegate. How are you? This
Hey,
is Kathy Call with the Government Affairs team. So yeah, thank you so much for having us on today. As Lindsay said, we do have the one amendment that we are going to provide the right to counsel to the incarcerated individuals at the time if they wish to file an appeal to the decision, to the Medication Review Committee decision. As far as the amendments that were introduced by the Psychiatric Association, I feel unprepared. I have not looked at those as of yet. Dr. Beneski, I think, is on this call as well. Dr. Beneski, have you had a chance to review those amendments?
From Ms. Burton?
Yes.
Yeah, I apologize. I haven't, some of what was discussed about having layperson knowledgeable of the thing, I think that's important. I did think she said that she wanted a family member present, and I'm not quite sure about that. So I have to be honest with you too, ma'am. I have not been able
All right,
to.
so it sounds like you're open to the conversation.
Yes, ma'am.
Okay, and Ms. Hilliard, are you here for OPD?
Yes.
Okay. And with these, if the First Amendment is taken and there's some discussion around that Second Amendment, does that address your concerns? And will you come to at least a neutral position on this bill?
No, those don't address all of our concerns. And just to highlight, we do think there are still differences between the way that House Bill 279 is written and how General Article 10708 is written. And we do want to highlight that there is a significant difference in the licensure in the requirements for licensed mental health infirmaries compared to the hospitals at which other involuntary medication can be administered over objection. We highlighted in our testimony that we would like to see this occur only in emergency situations, not in non-emergency situations. And we would also like to see the administration of the medication over objection in hospital settings.
Okay, so I tell you what I'm going to do. Sounds like you guys have some stuff to work out. So I am going to ask delegates Austin, Riley, and although I don't see, I think I'm going to ask Delegate Kaufman, he had a lot of questions, to work with both sides and come up with something that is reasonable, that protects the patients and still make sure, as you heard me say during the hearing, that we recognize that this is psychiatric pain. And if we don't find a way to help these folks who need the medication, that is the same as denying someone their analgesics when they're in pain. So we're going to work with you all to find that sweet spot. Delegate Austin, would you be willing to lead that group? And Delegate Riley, are you good with working on that?
Yes, I will have my office reach out and schedule a meeting.
Okay. Ms. Jones, you have your hand up.
Yes, can you include, I'm Lisa Harris-Jones, I represent Maryland Psychiatric Society. Can you include a representative from MPS in that discussion as well?
And what is your, I understand your interest. Can you explain your position, or what is your particular focus that would not be represented otherwise?
Sure, if I can have Dr. Hansen or Ackerman respond to that question. We haven't seen the amendments, I don't believe. So I want to make sure that, because we came in originally in support, but we would like to see the amendments, and I want to make sure they're comfortable with them.
Okay, that's fine. Delegate Austin, are you comfortable with including them? Okay, all right, then we'll do that.
And
All right.
Delegate Hill, my name's Josie Friedley, and I work with Capital Strategies. We represent Centurion. They're the mental health care providers for the incarcerated population. So could they also be included in this discussion?
And their position as compared to DPSCS, which
They align similarly with DPSCS.
I'm going to let Delegate Austin and her work group make the decision about that. I'm not trying to pull any people out, but I want to make sure that we find a way to move this thing forward. And I'll let her work with you all, make a decision about whether she wants you to be at the primary table or to bring you in once something's been worked out.
And what I would suggest is, if I may, Madam Chair.
Sure, absolutely.
Anybody that's interested in working, if you believe you're a stakeholder, go ahead and email my office today. We're going to pull together a meeting, and we will see how it goes with the first meeting with bringing everybody to the table. And then if we feel like we need to exclude after the first meeting, we'll do so accordingly.
Okay, does that sound fair to everybody? All right, that's what we'll do. Thank you all for being here, and thank you all for your willingness to work with us.
And may I interject one thing?
Sure.
I just want to clarify, there haven't been any amendments formally offered on this bill. What I described is committee testimony that's been received on the bill. So I was just summarizing the committee testimony.
Okay. All right. And again, we're open to whatever you all need to work out and any other amendments that are offered. So thank you. Okay,
Thank you so much.
Lindsay. And we're going to move on now to HB 279. Chris, can you I'm sorry, that was 270. Let's go to HB 181.
Thank you, Madam Chair. The bill requires a restaurant to offer a written disclosure of each main food allergen that a restaurant knows or reasonably should know is contained as an ingredient in each menu item. The disclosure must use the common names of main food allergen or standardized pictograms. The disclosure may be written on the menu, available in digital format like a QR code, a separate allergen-specific menu, an allergen chart, grid, or booklet, or any other written material. The bill does not apply to prepackaged foods that are subject to federal labeling requirements for main food allergens. A restaurant that violates the bill's requirement is subject to existing civil and criminal penalty provisions for food establishments. We did get a couple of amendments from the sponsor. The one that was most recently forwarded to us adds 11 provisions to the bill, and I'll go through them as quick as I can.
Okay, let's just hold up 1 second if you
Okay.
can. I'm looking to see, is anyone here from Delegate Wood's office?
Yes.
Okay, all right, then please continue, Chris. I wanted to be sure. Okay. Go ahead, Chris. I'm sorry.
That's okay. The first or the most recent amendment in concepts, they add a new definition for restaurant, which is borrowed from the alcoholic beverages article and the Cecil County title. It is a restaurant means a business establishment, one that is for the accommodation of the public, is for the accommodation of the public. Two, that has a proper and adequate dining room and sufficient facilities for preparing and serving meals. Three, that has been approved by the board. And four, whose average of annual receipts from the sale of food comprises at least 25% of the average receipts of the business. The second thing, a disclosure provided under this section is based on ingredient information known or reasonably available to the restaurant and does not constitute a guarantee that a menu item is free from cross contact with a major food allergen. The next one, a restaurant shall make a reasonable effort to inquire whether a customer has a food allergy. If a customer fails to disclose a known food allergy after being provided notice under this section, the restaurant may not be held liable under this section for that failure to disclose. A restaurant that acts in good faith to comply with this section and relies on ingredient information provided by a supplier or manufacturer is not subject to civil or criminal liability for inaccurate allergen information resulting from erroneous or incomplete information provided by a supplier or a temporary change in supplier outside of the restaurant's control. Nothing in this section may be construed to alter, limit, or expand any duty a restaurant may have under other applicable law to reasonably ensure the safety of its patrons. If a restaurant uses an alternative supplier for an ingredient and the substitute ingredient contains a major food allergen not previously disclosed, the restaurant shall update its written disclosure or provide notice of the change in a manner consistent with this section. Displaying clear allergen signage or standardized language in a conspicuous location. I think these are amendments to what is okay under the bill as disclosure. So displaying clear allergen signage or standardized language in a conspicuous location, using standardized symbols or icons, using any other comparable method that provides written access to the required disclosure to include, and then the previous list forms of disclosure. A restaurant is required to update a disclosure only when there is a change in ingredients or supplier information that affects the presence of a major food allergen. The department shall consult with representatives of the restaurant industry and food allergy advocacy organizations in developing guidance or regulations to implement the section. The department may adopt regulations as necessary to implement the section, and a restaurant that operates 2 or fewer locations nationwide shall have an additional 6 months after the general effective date of this act to comply with the act.
Wow.
That was the first one. If we can ask Delegate Woods' office, are they still offering the amendment that was offered last subcommittee meeting?
Okay, so you all had one that you offered last week. Is that included in this amendment? Is it separate from this amendment that was just read? Or is it one that you're withdrawing?
It's included.
Okay, so we don't need that one too. If we took this amendment, that would include, we just need this one
No, we
amendment
need
of
both. They would
concept.
need both.
Yeah, we need both.
We need both,
They
so
do
it's not
different
included.
things.
But you want both.
Yes.
Okay. All right. I'm gonna ask, obviously that's amendment in concept, so we're not able to vote on, but let's have a quick discussion. Let's hear from the Restaurant Association.
Thank you very much, Madam Chair. Melvin Thompson, representing the Restaurant Association of Maryland. And the bill sponsor's office did share with us this morning these amendments in concept. Our internal legislative committee met yesterday, and so I will need to share those with that committee in order to get feedback. We also had drafted yesterday some amendments that we would like to see drafted that we're going to share with the sponsor's office today. I'm waiting to get approval back from my legislative committee, but there are a number of additional concepts that we've put into our amendments since the initial draft that we shared with the bill sponsor's office last week. And so we're still working on those amendments and would like the opportunity to share those with the sponsor's office, get feedback internally on the amendments they shared with us this morning, and then let the subcommittee know what we think after that.
It sounds like a discussion. Delegate Hutchinson.
Thank you, Madam Chair. Christopher, thank you for going through all those amendments. I just missed at the beginning who offered all those amendments.
The sponsor.
Okay, thank you.
Okay. All right. So it sounds to me, if I'm hearing that the sponsor is offering to do some things to bring folks aboard. The Restaurant Association is offering some things. And if we give you guys till next week, we maybe have consensus. Does that sound about right?
Yes, ma'am.
Is that right, Mr. Thompson?
I would say that we are working towards consensus. There may be some things that we may not agree on, to be perfectly frank, Madam Chair, and those might be some amendments that we offer for the subcommittee's consideration if for some reason the bill sponsor is not receptive to those amendments.
Okay, I'm going to take Delegate Riley and then I'll take Delegate Hutchinson.
Thank you, Madam Chair. We also had some unfavorable or possibly, well, it was unfavorable from the Maryland Retailers Alliance. Have we heard from them or are they on the line? I'd like to hear if they have any amendments as well. Or
Are they are here, Ms. Price?
Thank you, Madam Chair. We are generally supportive of the efforts that are being made by the Restaurants Association. We believe that the existing federal standard for restaurants with 20 or more locations would be more appropriate. I think we appreciate the thought behind giving small restaurants an extra 6 months to comply, but ultimately our concerns with the legislation were around the long-term ongoing administrative burdens of compliance should menus continue to change over time. But we look forward to seeing whether the sponsor is receptive to the restaurant's amendments.
Okay, Ms. Riley?
yeah, so basically what I heard is that you two are working together on the amendments pretty much with the restaurants and the retailers.
Yes, we're supportive of Melvin's efforts.
Okay.
And Ms. Price, you referenced the administrative burden on small restaurants. So I heard a list of various things that frankly, most of the restaurants I go to already do. So what's the administrative burden when it could be a chalkboard or a whiteboard that you write on?
So the feedback that we received from smaller restaurants that are located like in Main Street communities is that their menu may be much more likely to change on a weekly, monthly, seasonal basis even. And so if they are having to make ingredient substitutions on the fly or they're changing a vendor unexpectedly, that type of minuscule change, I think, is much more likely to happen at a smaller restaurant than at a large chain that has a lot of their logistics kind of locked down or sent down from corporate. And so given the additional changes that may be happening at those businesses and the general smaller number of staff that they're likely to have, it's a lot more work on the individual people who are owning and running these restaurants versus a larger chain being able to just get the new menu from corporate, they roll it out and they're done.
All right. Okay. So you've explained that. I'm just going to, I guess, I'm not going to put this as a question. I'm just going to say that as you roll that out and I listen to what the sponsor is offering, I'm having a hard time seeing where that's a burden. And I'm seeing that as pretty much what people are already doing. And especially when there's language in there that you could say, any of this food can contain any of these items. There's nothing to prohibit somebody from saying that. So even as the menu changes, it's basically just saying, yeah, we do use eggs, nuts, blah, 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 blah. So I'm having a hard time. I'm just letting you know. I can't speak for my members. But if in the end it's the administrative burden piece that you're coming back with, I'm going to let you know up front in all transparency, I have a hard time. The case hasn't been made to me that this is a really huge administrative burden. Okay, so that's just where I'm leaning. I'm open to hearing how it is and be happy to visit more restaurants in my area to find out why it is. But the discussions with the restaurants who are single owned, single non-chain has not supported that concern. And I'm concerned that maybe your members are not actually reading the details of the bill. And I hope that they will look at it with the offered amendments, including the ones that the Restaurant Association seeing, which you guys can work out. And with that, Mr. Thompson, I'm not going to go back to you. I'm going to let Delegate Hutchinson have the last bite of the apple.
Madam Chair, thanks for bringing that up, because I guess now I'm confused about the bill, because I thought I asked in committee, could the restaurant just put out one blanket statement that said, hey, you come into my establishment and there's a possibility that my food may have this, which all could be an allergen. And does that, which it sounds like what you were just talking about, handle this bill and the effort that they're trying to take? I viewed it as this is a lot more specific, that each menu item had to be listed, had to be notified, which then creates that administrative burden to the small restaurant owner. But if this bill is you can put out one big blanket statement and you're protected, then it's a different story in the way I've been reading and interpreting the bill.
Ms. Aloma?
So, and thank you, Madam Chair, and thank you, Delegate Hutchison. In the initial draft of the bill, it was very specific, and we offered an amendment in this new draft that we had sent over to the committee. And the 7th Amendment clearly states that displaying clear allergen signage or standardized language in a conspicuous location. So it can be a chart, it can be a whiteboard, a blackboard, and a statement that says, all these allergens are present in our foods in the restaurant. Please be aware. I would hand it over to Alexa.
Alexa, just real quick, because we're going to move on to the next bill. Sounds like you guys just have some conversations to be had.
Yeah, I think just really quick to add, to respond to your question. Thank you, Madam Chair. I think that a statement like the one that you suggested, that any of the top 9 food allergens could be listed in the food, is likely going to be put on the menus, Delegate Hutchinson. But you're right in the fact that there would be a requirement that the main food allergens be identified for things in the food, because a general statement like that is not necessarily helpful for people with food allergies. The idea here is that we're trying to make this a safer environment for the 10% of Marylanders that have life-threatening food allergies.
All right, so we're going to let the sponsor continue to work this through.
But Madam Chair, if I may, I'd say that statement then makes me still confused about this bill, and
that's why the sponsor is going to work it through.
Got it. Thank you.
Okay. All right. Thank you all. Okay, let's go on to HB 410. Chris.
This bill establishes new requirements regarding labeling of food items and milk products for human consumption and prohibits the sale of items labeled with a sell-by date that do not meet such requirements. Beginning July 1st, 2027, a food manufacturer, processor, or retailer and a grade A milk plant or processor must use specified phrasings to indicate quality date or safety date on any food item offered for sale. The bill's food labeling provisions do not apply to infant formula or beer or other malt beverages. By July 1st, 2027, the Department of Health must create and post on the department's website educational materials to inform consumers about the meaning of quality and safety dates and adopt regulations to carry out the bill. We did receive an amendment from Delegate Boyce. The amendments clarify that the Department of Health will develop the consumer education program in conjunction with the University of Maryland Extension. The amendments add an explicit exemption for federally regulated food items. The amendments shift the primary compliance date from July 1st, 2027 to July 1st, 2028. And the amendments allow retailers to sell or offer for sale food products and grade A milk products that do not yet meet the new labeling standards if those products were purchased on or before June 30th, 2028.
Okay. All right. And then we did receive from the department yesterday evening the following statement. Actually, someone here from the department? Okay.
Hi, Delegate. Yes.
Yeah, go ahead.
Madeline Farrar for the department. So MDH did have a conversation with the extension yesterday, and I can pass it to them after to speak on their thoughts. But we reached out to discuss, exploring options of ways we could partner on this effort. However, we're still concerned that given there's no additional funding for these efforts, it still presents a challenge for MTH for the educational campaign and still requires significant, financial resources and staff resources from the department.
So explain again, I'm missing the understanding where that's, so it's the education piece that's the problem? What's the staffing and financial piece that you're talking about?
So I can pass it to the extension as well. But if this we're happy to partner with the extension on this, but in terms of the financial resources to take up some of the educational campaigns on the MDH side, this would, one, require highly specialized expertise that we currently don't have. And
But I'm sorry, to put out an ad campaign? I'm missing I'm a little dumb. Just be real clear with me. What is it that requires so much specialized? I mean, I see ads all the time, and I see brochures going out all the time, and educational posters going out all the time. So I'm not clear on what the highly specialized training to say this label means blah, blah, blah. What's the...
Absolutely, Delegate, and not at all, not at all. I will absolutely clarify. So the regulations portion, I think is where we, are looking at that additional expertise, and then the financial resources for that educational campaign is just more involved with the regulations piece, but also the educational campaign would just require resources. As you said, the pamphlets, the brochures, the booklets require financial resources. But, I think I can pass it to Shauna as well. We touched.
That's fine. Okay. I'm going to just ask Delegate Boyce's office to speak up.
Hi, everyone. Meredith Riley here on behalf of Delegate Regina T. Boyce. We did offer or submit some amendments yesterday for this bill. I think we just got them back like an hour ago, so Delegate Boyce has not had a chance to review them. But I can kind of go over what we submitted for now.
Is that different from what Mr. Daphne just read? It's the same thing.
No, it's the same.
Okay. All right. And so do they address this issue with the education piece and the cost of the education piece?
So our first amendment specifically added UMD Extension in as a partner organization that the Department of Health can collaborate with.
And the Department of Health said that they've spoken to them and they can partner with them, but it's still expensive.
Yes, I didn't know that they'd had that conversation. That's new to me. So I apologize for not being up to date on that. It was our hope that adding UMD extension specifically in the bill would help alleviate MDH's concerns. But if not, I guess there's more work to do.
All right. It sounds like we've got the extension MDH and the sponsor willing to have that conversation. And then I think Ms. Locklear, you had some concerns. Do these amendments address your concerns?
They do not, Madam Chair. And I talked about this in committee, and you guys have seen it for years, but these state-by-state patchworks for labeling requirements do create significant costs. When those requirements differ across state lines, manufacturers have to produce multiple versions of the same label, segregate inventory based on destination, redesign their packaging, and adjust logistics and distribution systems. And all of that costs money. We did get some estimates from some of our regional operators. And again, these costs will be passed on to consumers who are talking about $200,000 to $300,000 to separately label their private label products just for Maryland, because this doesn't exist anywhere else in the region. And I need to notate this, and we talked about this in committee as well. And I did a side by side of the differences in the California law and then in Maryland's law. And I did speak to the sponsor about this yesterday. But California exempted milk and egg products. And that's in part because of federal existing law. We also have a law in Maryland around milk and milk products. It's a Milk Products Act. And so those exemptions reflect longstanding recognitions about inconsistent state requirements and the problems with interstate commerce. So,
all right, let me interrupt. We're not moving the bill today. Sounds like it's the same arguments you had before. And I want to see if the members have any questions. And again, the question I had is the same one I raised then. A lot of this is stamps. You know, if I put a lot out today, it gets a different date on it than the lot I put out tomorrow. So I'm confused about all these new labels, things, because we're talking about dates that change every day. So I'm not clear about that, but I'm going to let the sponsor work with you all in MDH and the extension school. But again, I for one need a little bit more understanding of why that is so burdensome when the date on products has changed with the lot. The lot numbers changed, the dates changed, and all those things happen. So we'll let you guys, we're going to hold this bill and we'll take it back. And I know Mr. McLukey, you wanted to speak, but we're going to go on to our last bill because we're running tight on time and members have other subcommittees to get to. Okay. All right, Chris, let's go on to HB 417, please.
Sorry. Okay. This bill originally prohibited a retailer from distributing or selling a medetomidine product or a xylazine product unless the purchaser provides proof of intent to use the product for institutional, veterinary, or scientific purposes. A retailer may not distribute, sell, or expose for sale a medetomidine or xylazine product to an individual younger than 21. A retailer that distributes, sells, or exposes for sale the products must maintain records of all sales, including a copy of the identification used as the purchaser's proof of age, and each document or other material used as proof of the purchaser's intended use. A retailer that violates any of the bill's prohibitions is subject to a civil penalty of up to $3,000 for a first violation and $6,500 for each subsequent violation. Civil penalties must be deposited into the Maryland Substance Abuse Fund, and the Department of Health must adopt regulations to implement the bill. The sponsor has submitted amendments, and the amendments basically change the bill to a different bill where we are adding under the criminal law article what counts as a Schedule III drug. We've listed medetomidine and xylazine under that.
Okay. All right. Delegate Pippy.
Thank you, Madam Chair. I'm going to make it short and sweet. The only opposition to the bill was the veterinarians. They wrote a letter of support saying they believe that we should schedule it as a Schedule III drug because vets already work daily with scheduled drugs, and that would be the best fit for them. Also, Ohio, Pennsylvania, West Virginia, Delaware, Florida, Rhode Island, South Dakota, Massachusetts have all scheduled these drugs. So every single state surrounding Maryland has either scheduled it or passed legislation. And so I think everyone's on board at this point with just scheduling it as a Scheduled III drug. And that seems to solve any concerns with the bill.
Okay. And Chris, we have that letter?
I have not received it yet.
Okay. Members, any questions about the the amendments or the bill as amended? Not a one.
Yes, hold on,
Okay.
sorry.
I'm sorry. Go ahead, Delegate Riley. I
Yes.
missed you. Sorry.
Yes, so the amendment that Christopher was talking about, yeah, I don't have that one in my
We should have
packet.
a reprint. A reprint was sent around.
Okay.
What
All right,
time was that? Okay,
and
go
who
ahead.
who was the sponsor of that amendment?
Delegate Pippy.
Okay. All right. So, so the amendment that I just heard Delegate Pippy say that he wanted to mention was the one that Christopher said that he didn't have the letter from the veterinarians. So I do have that, and basically the only amendment that we need is one that, like he just mentioned, is that they said in the letter, we are happy to assist with this legislation and drafting a bill that would schedule these substances, and they would be happy. So if that was I mean, it didn't sound like that was the amendment that Christopher was talking about. But yet I know Delegate Pipke had mentioned that. So is that the amendment we're accepting? Just
Well,
making it
no
a
one's,
scheduling?
yeah, no one's moved the amendment yet, but
Okay.
and if what you're suggesting is you want the members to look at the letter of support that that as Delegate Pippy
Veterinarians.
described it, and what you're describing as a willingness to support. And we need
Just
clarification on that, that
scheduling it, yes.
we can ask them to clarify for us. And then hold any vote on the amendment till next week.
Okay, because yes, I do agree. That was the only opposition that we had from that, from that organization. And they had suggested, I think, a good option. And it seems like the sponsor agrees with that
Is
as
that
well.
from,
So,
is that letter from the testimony? Is that the witness testimony from the hearing?
No, they sent it separately. This was
Okay.
sent yesterday on the 16th.
Okay, Chris, can you clarify and then we'll take it back to Delegate Pippy.
And then Delegate Pippy may have something extra to say there. Thank you.
Chris, anything to clarify there? Your hand's up.
Oh, no, sorry. That was my question. I was wondering if it was the written testimony or a separate letter.
Okay, Delegate Pippy?
Yeah, so just to clarify, so I met with the vets and they came in my office and said, if you schedule it as a Schedule 3, we're good. And so they said they sent that new letter to the committee. Madam Chair, I had my assistant just send that to you just now, so that should be in your inbox. And in that letter, they said they will support scheduling it as a Schedule 3 drug. And so to Delegate Riley's point, my bill only does one thing now. It just schedules those 2 items as Schedule 3 drugs in Maryland to be in alignment with all of our surrounding states. And I think we should all be on the same page. And my amendment literally does just that. It just schedules both those items as Schedule 3 drugs. It's very clean, and hopefully that resolves any remaining issues.
Okay, members? Is there a motion either to hold the bill to next week to look at all the stuff or to move the amendment?
I'd like to make a motion to move the amendment.
Now I would like to second.
Okay. All right, let's do a hands vote. All in favor of moving the amendment, signify by saying aye or raising your hand of one type or another. Okay, any hands down? Anybody opposed? Delegate Hutchinson, I think that's a joke hand. You want to bring that down? Is that correct? Okay, so you're not in opposition. Okay, and anybody abstained? Okay, anybody want to move the bill as amended?
Yes, move the bill as amended.
Second.
Okay, all in favor, say aye. Show of hands. Okay, and any opposed? Any abstained? Okay, Delegate Pippy, thank you very much for doing some work on that bill this year.
Thank you for all your help, people. Appreciate you.
Okay, and with that, we are done for today. Thanks, everybody.
Motion to adjourn.